Okay, let's unpack this. Imagine you see a dog or maybe a cat, and their eyes are doing something really quite strange,
Yeah.
like moving rapidly back and forth, maybe up and down. And it's totally involuntary. It looks, well, disorienting, maybe even a bit alarming.
Right. And that specific rhythmic eye movement you're describing, that's called nystagmus. And, while it looks like maybe just an eye thing,
Mm.
our source material makes it clear it's almost always a sign pointing to something going on deeper inside, specifically within the nervous system.
Right, the balance system.
Exactly, particularly the system responsible for balance, the vestibular system.
Okay, so our mission with this deep dive, then, is to really explore a detailed veterinary source that focuses just on nystagmus in dogs and cats.
Yeah.
We're going to try and pull out the essential insights for you.
Yeah.
What it is you're actually seeing, why it happens, the pretty wide range of potential causes.
It is wide, yeah.
And maybe most importantly, how veterinarians actually approach diagnosing it and managing it.
Think of this as your personal guide, maybe, through this really fascinating intersection of eyes and balance in pets. We're taking this, sometimes complex veterinary information and trying to distill it down so you can understand what's really going on when those eye movements appear.
So let's get right to it then. The core definition from our source. What exactly is nystagmus?
Well, at its simplest, the source defines it as involuntary rhythmic oscillation of the eyeballs. Keyword there is involuntary.
Right, not a conscious movement.
No. And the source describes two main types. They sound quite different, actually.
Yeah, they do. What are they?
So the most common type is called jerk nystagmus. This is characterized by a sort of slow drift of the eye in one direction,
Okay.
followed by a quick, fast snap back in the opposite direction,
Right.
a compensatory phase.
Okay, like a smooth pan and then a quick reset. Makes sense. And the other one?
That one's pendular nystagmus. It's less frequent and it looks different, more like small oscillating eye movements. They're kind of smooth, and they don't have that distinct slow phase, fast phase pattern.
And the source mentioned, didn't it, that this pendular type can sometimes just be nothing to worry about, particularly in certain cats.
Yeah, that's noted. It can be an incidental finding, especially in breeds like Siamese, Burman, and Himalayan cats.
Okay.
It might be linked to a sort of congenital thing where the optic nerve fibers cross differently. But, and this is important, pendular nystagmus can also be a sign of something like cerebellar disease or vision problems in any animal.
Right, so not always benign. Okay, so we know what the eye movement looks like now, but how on earth does this eye wiggle connect to balance? That still seems a bit counterintuitive.
Yeah, it does seem odd at first, but this is where the underlying wiring, the pathophysiology, comes in.
Okay.
The source explains there are these direct neural pathways, basically connections from the vestibular nuclei, those are the balance centers in the brainstem, that connect straight to the cranial nerves that control eye movement. We're talking cranial nerves, third, four, and sixes. They move the eye muscles.
So wait, the brain's balance department is actually hardwired directly to the eye muscles.
Precisely. This whole system, it's designed to coordinate your eye movements with your head movements. It helps you maintain focus when you move your head.
Oh, okay.
It's called the ocular vestibular reflex.
And that leads to something the source calls physiologic nystagmus, right?
Yeah.
Which is actually normal.
Exactly. Physiologic nystagmus is what happens when you trigger that normal reflex. So if you turn an animal's head gently, you'll see a jerk nystagmus. The eyes drift slowly opposite the direction of the head turn, trying to stay focused, and then they snap quickly back in the same direction as the head turn.
Okay.
That's the system working just like it's supposed to. And actually, a key point is that if that doesn't happen, if it's decreased or absent, that suggests vestibular disease.
Got it. Normal head movement causes normal temporary nystagmus. So pathologic nystagmus, the kind we're actually worried about here, must be different.
It is, absolutely. Pathologic nystagmus is also usually a jerk nystagmus, but the really critical difference is that it occurs spontaneously, meaning it happens even when the animal's head is in a normal, still position. It's not being induced by movement. It's a sign that the vestibular system itself is not functioning normally.
And when a vet sees this pathologic kind, they describe it by the direction, right? Like, is it going side to side, horizontal? Or sort of circular rotary, or up and down vertical.
Exactly. They note the direction of the eyeball movement, and crucially, they also note the direction of that fast phase.
Why the fast phase?
Because the direction of the fast phase is a really important clue for figuring out where the problem might be located in the nervous system.
Ah, okay.
Right.
And the source also mentioned a difference between spontaneous and positional nystagmus.
Right. Spontaneous is the kind we just talked about, happens with the head still, and the source notes this often improves after several days as the brain compensates. Positional nystagmus, though, only shows up when you put the animal's head into unusual positions. And that can sometimes be seen with more chronic or maybe less severe underlying issues.
Okay, so we've defined it, we understand the link to balance, and how vets describe it. Who tends to get this? What does the source say?
Well, the source notes that nystagmus, really as a sign of vestibular disease, is considered a relatively common clinical presentation in both dogs and cats. So vets see it fairly often.
Any particular age or breed that's more susceptible?
Generally, no specific breed or sex predisposition is mentioned overall. We talked about the pendular exception in some cat breeds.
Right, the Siamese and Burmans.
Yeah, but otherwise, age can vary a lot depending on what's actually causing it. For example, older animals are definitely more prone to things like tumors or vascular issues like strokes, and also a specific condition called canine geriatric vestibular disease.
Okay, and this leads us to, I think, the critical puzzle that vets have to solve. Figuring out where in that vestibular system the problem actually lies.
Yes.
The source makes this major distinction between peripheral and central vestibular disease. This seems like the core of the whole diagnostic process, right?
It absolutely is. Differentiating between peripheral and central causes is probably the most important first step. It guides everything else.
Okay, so let's break that down. Peripheral problems, where are they located?
Peripheral problems are located in the sort of outer parts of the vestibular system. So typically the inner ear itself, or the vestibular nerve as it travels from the inner ear towards the brain.
So things affecting the ear, basically.
Exactly. A really common peripheral cause is infection of the middle and inner ear that's called otitis media interna.
Right.
Other peripheral causes could be inflammation, certain types of tumors affecting that nerve or the structures around it, physical trauma, or sometimes reactions to certain toxins. And then there's also idiopathic vestibular disease, meaning we don't know the cause in both dogs and cats, like that canine geriatric vestibular disease we mentioned.
And the source specifically called out some potential toxic culprits for peripheral signs, didn't it? Things people might even use on their pets.
It did, yeah. Systemic antibiotics like aminoglycosides were mentioned, and also some topical ear cleaners or solutions containing things like iodophores or chlorhexidine if they get into the middle ear.
Right. Good to know. Okay, so that's peripheral, basically, ear or nerve-related issues. What about central vestibular disease? Where's the problem there?
So central problems are inside the central nervous system itself, specifically within the brainstem or the cerebellum. These are the parts of the brain really responsible for coordinating movement and balance.
Okay, and this sounds potentially more serious.
It often is, yeah. The list of causes for central disease is pretty diverse, unfortunately. It includes things like infections, viral, bacterial, fungal, protozoal.
Wow.
Yeah, quite a list. Also inflammation that isn't caused by an infection, like certain autoimmune conditions. Then there are tumors growing within the brain, nutritional deficiencies like lack of thiamine, trauma to the head, and vascular events. So bleeding in the brain or an infarction like a stroke.
And toxins can cause central signs, too.
Yes, toxins can also cause central signs. The source mentions things like lead, hexachlorophene, and actually metronidazole, which is an antibiotic.
Metronidazole again. Didn't that come up under peripheral, too?
Well, metronidazole toxicity is most commonly associated with central vestibular signs, especially at higher doses. The source specifically mentions avoiding daily doses over 60 mg/kg.
Okay.
Although it notes that toxicity can sometimes happen even at lower doses in susceptible animals.
Wow, okay. That is a lot of potential causes. So how does a vet even begin to figure out which one it is? And crucially, differentiate peripheral from central? What are the clues they're looking for during the exam?
This is where the neurologic exam becomes absolutely critical. The vet looks very, very carefully at the character of the nystagmus itself, and just as importantly, for the presence or absence of other neurological signs.
Okay, let's start with the clues that point towards peripheral vestibular disease. What does that look like?
Okay, so if the problem is peripheral, the nystagmus itself is typically horizontal, side-to-side, or rotary, sort of circular.
Right.
A really crucial clue is that the fast phase, that quick snapback, is almost always directed away from the site of the lesion, the affected ear or nerve.
Away from the bad side.
Exactly. And another key thing is that the direction of the nystagmus doesn't change no matter how you position the animal's head. It stays consistent.
Okay, so horizontal or rotary, fast phase points away, and it's consistent. What else?
Other signs you'll often see with peripheral disease usually involve balance. So a head tilt is very common, some incoordination or wobbliness, maybe circling, or even falling or rolling. And these signs are typically ipsilateral, meaning they're on the same side as the affected ear or nerve.
Okay, same side.
And sometimes you might also see other signs on that same side, like maybe a droopy face from facial nerve issues or Horner's syndrome, that's a droopy eyelid, small pupil, that kind of thing.
And that happens just because those other nerves run so close to the vestibular nerve inside the skull?
Precisely. An issue in that small anatomical area, like an inner ear infection, can easily affect those neighboring nerves too.
Okay, that makes sense. Peripheral. Horizontal, rotary, nystagmus, pointing away. Usually same-sided head tilt wobbliness, maybe those facial or eye signs too.
Yeah.
So then, how does central vestibular disease look different? What are the big red flags for a problem inside the brain?
This is where you see some really key differentiators. With central disease, the nystagmus can still be horizontal or rotary,
Okay.
but a major red flag is if it's vertical. Up and down nystagmus. Vertical nystagmus almost always points towards a central problem, usually in the brainstem or cerebellum.
Okay, vertical equals central. Got it. That's a big one.
It is. Another really key sign suggesting central disease is if the direction of the nystagmus changes depending on how you move the animal's head. Remember, with peripheral, it was always consistent.
Right, it didn't change.
With central, it can be variable. It might be horizontal one way, maybe rotary, or even vertical when you tilt the head differently.
Okay, so vertical or changing direction, those point strongly to the brain. What else are they looking for?
Beyond the nystagmus itself, probably the most important indicator of a central problem is the presence of other signs suggesting more widespread brain dysfunction.
Like what kind of signs?
This could include things like changes in their mental status. Are they dull, lethargic, even stuporous? Do they have generalized weakness or difficulty moving, what we call paresis? Or maybe they have trouble knowing where their feet are in space or placing them correctly. Those are called postural reaction deficits. Seeing those kinds of deficits is a very strong indicator of a central lesion. Other cranial nerve problems, beyond just the vestibular ones, can also pop up.
So basically signs that more than just the balance system is affected, more widespread neurologic problems.
Exactly. And the source also mentions this really interesting, sometimes confusing situation called paradoxical vestibular disease.
Oh, wait.
What's that? This can happen with certain lesions in the cerebellum. What's paradoxical is that the general deficits, like those postural reaction problems, the weakness, are on the same side as the lesion in the cerebellum.
Okay.
But the head tilt and then nystagmus fast phase point to the opposite side.
Whoa, okay. That is confusing, but I guess it really helps pinpoint the cerebellum specifically.
It does. It's a specific localizing sign.
Yeah.
So to recap, central clues: vertical nystagmus, changing direction nystagmus, and those other general brain signs like weakness or postural deficits are the big ones.
Okay. So the neurological exam gives huge clues. What diagnostic tests do vets typically use after that to confirm things?
Well, routine blood work, biochemistry, urinalysis, those are often run just to check overall health, rule out systemic illness, look for clues of toxicity, that sort of thing. Often they're normal in vestibular cases, according to the source.
Right.
Other specific lab tests might be needed depending on what's suspected. Maybe a thyroid profile if hypothyroidism's on the list, or checking antibody titers for infectious diseases, or even culturing fluid from the middle ear if infection is suspected.
And imaging sounds like it would be absolutely critical here.
Oh, absolutely critical for confirming the location and trying to find the cause. If a peripheral cause, like that middle liner ear infection, otitis media interna, is suspected, then imaging of the bony structures around the ear, the tympanic bullae, is needed. And the source really emphasizes that CT, and especially MRI, are much, much more sensitive for detecting changes there than traditional X-rays.
Okay, so CT or MRI for the ears. And then for suspected central disease, you're looking at the brain itself.
Exactly. Advanced brain imaging is usually necessary to look for those structural causes like tumors, inflammation, evidence of stroke or bleeding. And again, MRI is generally considered superior to CT for looking at the soft tissues of the brain and brainstem.
And sometimes, I think you mentioned, they might need to analyze the fluid around the brain and spinal cord, the CSF.
Yes, exactly. If there's suspicion of a central inflammatory or infectious disease based on the signs or the MRI, then collecting and analyzing cerebrospinal fluid CSF analysis can be incredibly helpful. It can show inflammation, maybe identify infectious organisms.
Okay. So once they've gathered all these clues, the exam, the imaging, maybe CSF, and hopefully localized the problem and maybe even found the cause,
hmm
how is nystagmus and the underlying vestibular issue actually treated and managed?
Right. Well, the treatment really depends entirely on that underlying cause and also on how severe the animal's signs are at the time.
Makes sense.
Animals with central disease, as we kind of hinted, often require more intensive care, sometimes hospitalization, compared to many peripheral cases.
What kind of general support might they need, especially if they're really dizzy and unstable?
Good nursing care is absolutely vital. If
Hmm.
they're acutely nauseous, maybe vomiting, not eating or drinking, then fluid therapy is often needed to prevent dehydration. And for animals with really severe balance problems, especially if they're rolling or falling constantly, confining them to a safe, well-padded area is crucial to prevent them from injuring themselves.
And helping them get around safely.
Yeah, things like providing non-slippery flooring, locking off stairs, and giving them supervised assistance when they walk, especially early on, until their balance starts to improve.
Are there medications specifically to help with the dizziness or nausea symptoms themselves?
Yes, thankfully. The source mentions medications like meclizine, which is an antihistamine often used for motion sickness, or meropitant, an anti-nausea drug. These can help reduce the vomiting and maybe some of the dizziness associated with those acute episodes.
Okay.
And diazepam, which is a sedative, can sometimes be used carefully to help decrease the intensity of the vestibular signs in very acute severe cases. It's also specifically mentioned as helpful for treating metronidazole toxicity.
Right. But the real core of the treatment is always going after the root cause, if possible.
Precisely. Symptomatic relief is important for comfort, but the definitive treatment has to target the underlying problem. So if it's a bacterial ear infection, it's appropriate antibiotics. If it's inflammation, maybe steroids or other anti-inflammatories. If it's a tumor, treatment might involve surgery, radiation, or chemotherapy, depending on the type and location. If it's hypothyroidism, thyroid supplements. It's all about the diagnosis.
And the source included some really important warnings or cautions about certain medications too, didn't it? Things owners should be aware of.
Yes, these are crucial points. Firstly, avoiding drugs known to be potentially ototoxic damaging to the ear, like those aminoglycoside antibiotics we mentioned earlier. Especially important if the animal already has kidney problems, as that increases the risk.
Okay. And being really careful about putting anything in the ear canal if there's a suspicion of middle or inner ear infection, or if the eardrum might be damaged.
Absolutely critical. If otitis media interna is suspected, and particularly if you can't clearly see an intact eardrum, the source strongly advises against putting topical medications into the ear canal.
Why is that?
Because some of those medications, if they get into the middle or inner ear through a ruptured drum, can actually worsen the vestibular signs dramatically and could even cause permanent deafness.
Wow. Okay. Very important caution. And the warning about metronidazole dosage again.
Yes, just reiterating to use it cautiously and
Mhm.
try to avoid those high daily doses, generally over 60 milligrams, because of the known risk of inducing central vestibular dysfunction, though again, it can happen at lower doses too.
Okay. What do vets typically tell owners about the recovery process? I mean, seeing your pet suddenly unable to stand or walk straight must be incredibly scary.
Oh, absolutely. Client education here is essential for managing expectations and anxiety. The source points out something really encouraging. Many animals, even those with quite dramatic signs initially,
Yeah.
will often show significant improvement over the first few days to maybe a week.
Really? How does that happen if the underlying problem is still there?
It's because the nervous system has this remarkable ability to compensate for vestibular dysfunction, especially if the damage is static or only progressing slowly. The brain basically starts to adapt.
How does it adapt? What does it do?
It starts relying much more heavily on other sensory inputs to figure out the body's position in space. So visual input, seeing the horizon, seeing the room upright, becomes more important. And also proprioceptive input, the sense of touch and limb position from the feet on the ground.
Ah, so the brain learns to use the eyes and the feel of the ground to override the faulty balance signals from the ears or brainstem.
That's a great way to put it, yes. And interestingly, encouraging safe, supervised activity actually helps these compensatory mechanisms develop faster and more effectively. Lying in a cage all day can sometimes slow it down.
That's fascinating, the brain actively rewiring itself using other senses. The source also mentioned something about anesthesia potentially affecting things.
Yes, that's an important practical point. You might see a temporary worsening of the vestibular signs right after an animal wakes up from anesthesia.
Why would that happen?
The thinking is that the anesthesia temporarily suppresses or disrupts that neural compensation we just talked about. So when they wake up, the underlying dysfunction is sort of unmasked again for a short period until the compensation kicks back in.
Good to know, especially if surgery is needed for the underlying cause. Okay, so bringing this towards the end then, what's the typical outlook, the prognosis, and what about follow-up?
Well, the source is very clear that the prognosis varies widely. It depends entirely, 100%, on that underlying cause we've spent so much time discussing.
Right, so presumably something like idiopathic geriatric vestibular disease or maybe a straightforward ear infection generally has a better outlook than, say, a malignant brain tumor or a severe stroke.
Generally speaking, yes. The source explicitly states that animals with peripheral vestibular disease tend to have a better prognosis overall than those with central nervous system involvement.
And follow-up.
Follow-up usually involves a repeat neurologic exam, maybe after a couple of weeks, to see how things are progressing. Are the signs improving, staying the same, getting worse? That helps guide further decisions.
Are there potential long-term issues even if the animal recovers?
Unfortunately, yes, sometimes. Even if the underlying problem is successfully treated or resolves, if there was irreversible damage to parts of the vestibular system, the nerves or brain areas, then residual deficits can remain.
Like what?
The most common is probably a persistent head tilt. Some animals might retain a subtle wobble or incoordination, especially when they move quickly.
Okay. And can these problems come back? Is recurrence possible?
Yes, recurrence is possible with some specific conditions. The source mentions things like recurrent ear infections causing repeat episodes, and also notes that both canine geriatric vestibular disease and feline idiopathic vestibular disease can sometimes recur later in life.
Okay, so let's just try and tie this all together. We started with those, strange involuntary eye wiggles and nystagmus.
Right.
And we've really gone on quite a journey understanding how it connects fundamentally to the balance system, how the way it looks horizontal, vertical, rotary, changing gives crucial clues about where the problem might be. We explored this huge list of potential causes, differentiating between peripheral issues, usually in the ear, and central issues within the brain itself.
Yeah, covering everything from infections and toxins to inflammation, tumors, and strokes.
And we saw how the whole diagnostic process, the exam, the imaging, other tests, is really about detective work, pinpointing that location, that underlying cause, because that dictates the entire treatment plan and the likely outcome.
And that fundamental distinction, that peripheral versus central localization, based largely on the specific character of the nystagmus and the presence or absence of other brain signs, that's really the absolute central piece of the puzzle for the veterinarian.
Absolutely. Hopefully this deep dive gives everyone listening a much greater appreciation that nystagmus isn't just some weird eye movement. It's actually a critical signal.
Yeah, a signpost.
A signpost telling vets they need to perform a thorough neurological assessment and investigate the root cause. It's really a perfect example of how understanding one specific clinical sign can unlock a whole wealth of understanding about an animal's neurological health.
And maybe if we connect this to the bigger picture for a final thought, just consider that remarkable capacity of the nervous system to compensate for these quite dramatic vestibular disturbances.
Right, using other senses like vision and touch to help the animal regain its balance and function.
Exactly. It's pretty amazing when you think about it.
It really is, and it kind of makes you wonder, what does that incredible built-in plasticity and resilience really tell us about the brain's fundamental power to adapt, to recover, even after significant injury or disease? Definitely something worth pondering.